All right. Hi, everyone. Thank you for attending. I'm Dr. Thanawala. I've been at Capital Health since 2019. I work here as a cardiologist. One of my interests has really been preventative cardiology, especially in women, especially because, this is a topic that I think, we're realizing now that women are unique and different compared to men. A lot of the prior studies that have, determined a lot of the guidelines in cardiology have come from studies that only included men. So now I think the focus is shifting because we're realizing how different women are. And, so this is obviously being a female myself, this is a topic close to my heart. So I'm excited to talk to you guys today. Okay, so just some facts. So heart disease is the leading cause of death for women in the US. It tops all cancers, and I don't think people really realize that. It causes 1 in 3 women's deaths each year. That's approximately 1 woman per minute. Cardiovascular disease kills more women than all forms of cancer combined. We give a lot of importance to breast cancer and lung cancer and all these cancer awareness, associations, which is, obviously that's important. But I think we kind of put heart disease on the back burner when really it's the #1 killer for women. Only 44% of women recognize that cardiovascular disease is their greatest health threat. And 90% of women have one or more risk factors for developing heart disease, which they may not realize. Nearly 45% of women 20 and older have some form of cardiovascular disease, which goes undiagnosed until later. And less than 50% of women entering pregnancy in the US have good heart health, which is really important, especially women considering having children, because it is a huge strain on the body, including your heart, and not being heart healthy and becoming pregnant can have adverse outcomes, not just to the fetus, obviously, but to the mother and also future down the line. So understanding heart disease, I think we throw out this term a lot, but what does it, actually mean? So it's an umbrella term to describe different diseases involving the heart and vascular system. So the most common type of heart disease is coronary artery disease, and I think this is what we typically think of. It's, when there's plaque buildup in the arteries and, people can have heart attacks. About 1 in 16 women aged 20 and older have coronary artery disease. It develops when your coronary arteries become damaged or is diseased, usually from a waxy substance called plaque or atherosclerosis that builds up in the walls of the arteries. When your coronary arteries become narrow or blocked, it means, there's less blood flow to the heart. So sometimes this plaque can rupture and it can cause a clot to form in the artery, causing complete blockage of blood flow and leading to a heart attack. Okay. Coronary artery disease can cause chest pain, heart attack, like we mentioned. It can also lead to heart failure and abnormal heart rhythms. Some women have no overt signs of blockages in the 3 main coronary arteries, yet they can still have reduced blood flow to the heart due to blockages or dysfunction in smaller arteries, which can make diagnosis and treatment challenging. This is, also called microvascular disease or microvascular angina. And it's like I said, it's more prominent in women. There'll be no obvious signs of, disease, even on cardiac catheterization, or very minimal signs. But it's important for your physician to understand, like the nuances of the disease, what type of symptoms, and what the treatments are for that. So heart attack symptoms, can vary between men and women. Men tend to have more typical symptoms that we may think of, like, the chest pain, the jaw pain, pain in the back, nausea, vomiting. Women, on the other hand, may not always have chest pain. They may have shortness of breath, indigestion. A lot of patients that I see sometimes will say, I felt like I was just having some heartburn and decided to put it off, when in fact it's actually them having a heart attack. Extreme fatigue, palpitations. So it's really important to keep in mind. And, like I tell my patients, it's better to be safe than sorry. You may think that it's a small thing, but coming into the ER to get evaluated is always a good idea if you're not sure of what you're experiencing and if you feel something different. Be your own heart hero. So it's really important to be your own advocate. Getting screened every year, meaning, making sure you have your blood work on track, knowing all your medications. That's a big one. Like know exactly what your medical issue is, what your risk factors are, as in like personal, your family history, your blood work. All these things are really important to know and bring up to your PCP or your cardiologist if you have one. And if you want to get screened further, it's all it never hurts to ask your PCP to refer you to a cardiologist to have a more in-depth screening and discussion about your risk of developing cardiac disease in the future. Okay, so traditional risk factors for heart disease, they include diabetes, and this actually triples the risk of coronary artery disease in women, but only doubles it in men. So more important to pay attention to for us women. High cholesterol, smoking, high blood pressure, not exercising or just sitting for long periods of time. Mental stress and depression, it affects women's hearts more than men. Eating a diet high in salt, saturated fats, cholesterol, added sugar, being overweight or obese, and obviously having family history of early heart disease. The older we get, our risk of heart disease increases. And then certain ethnicities, including African Americans and South Asian women, are at a higher risk of developing heart disease. Risk factors that are unique to women, and some that you may not be aware of is menopause. So once women hit menopause or perimenopause, their risk of atherosclerotic cardiovascular disease increases. Having started menstruating or getting their periods before 10 or after 17, that's also a risk factor. Gestational hypertension, or preeclampsia, so high blood pressure or preeclampsia during pregnancy. Women may not realize this, but this actually increases your risk of developing cardiovascular disease in the future significantly. Same goes for gestational diabetes, preterm delivery for any reason before 37 weeks. Any adverse pregnancy outcomes, including gestational hypertension, diabetes, like I mentioned, small for gestational age delivery, placental abruption, they're all harbingers or red flags of cardiovascular disease later in life. Having PCOS, oral birth control while smoking, and then autoimmune diseases like rheumatoid arthritis, lupus, which are already more common in women. And then on top of that, increase your risk of heart disease. Breast cancer treatment, certain chemotherapies, radiation, these can all lead to cardiovascular events and cardiovascular disease. So a lot of women fall into these different categories, and it's really important for them to realize that they have this risk. So how do we reduce our risk of heart disease? So making healthy food choices to eat more plant-based and less processed foods. That's, number one. Lose weight if needed and quit smoking. That nothing beats quitting smoking. And don't start if you've never smoked. Reducing stress, getting enough sleep, limiting alcohol to less than 1 drink per day. And I think now there's even more data coming out on this, how, it's linked to so many different types of cancer. So really, honestly, just, even less than 1 drink per day for women is better. The lower, the better. Knowing your numbers, like I mentioned before, but I can't stress this enough, knowing your cholesterol numbers, your blood pressure, all of these things are really, really important. Make your health a priority, because if you aren't around, you're not able to take care of others. And as women, we're always taking care of others and thinking of everyone around us. But if we don't take care of ourselves, then we can't take care of anyone else around us. Okay, so a heart healthy diet, what does this include? So Lots of vegetables, fresh vegetables ideally. Dark, try to like make a rainbow in your plate is what, what they say. So green, red, orange, having legumes, fruits, grains, at least half of which are whole grains, low fat dairy, and then having a variety of protein foods, including, seafood, lean meats, poultry, legumes, nuts, seeds, and soy products. Foods that we need to limit. So saturated fat, and trans fat, really trying to lower these because it increases levels of bad cholesterol, and that in turn can clog the arteries. It should make up no more than 10% of your calories each day. Swap out saturated fats like butter for healthier fats like avocado oil or olive oil. Sodium. So this is a big one because it's linked to higher blood pressure, which obviously can, increase your risk of stroke, heart failure, heart attacks, all the things. So normal people with normal blood pressure we should still aim to intake less than 2,300 milligrams per day. This is less than 1 teaspoon of salt. So it's really low. And I'm not talking about like sprinkling the amount you sprinkle on your food. This is total sodium intake. So you have to read the labels, and you'll be shocked if you start reading the labels. There is so much sodium in the food we eat. Americans, we tend to consume about, like the average American, 3 to 4,000 milligrams per day. And as you can see, the ideal is keeping it less than 2,000. And if you have high blood pressure, that number drops to 1,500. So that's 2/3 of a teaspoon. Avoiding added sugars. This is another big one in the United States. We drink a lot of sugary beverages, and honestly, added sugars should account for less than 6% of your daily calories. So I just wanted to point out some of the sodium amounts in popular foods. So 1 tablespoon of ketchup, which is, a very small size, has already 160 milligrams of sodium. Cheese that we use for sandwiches, 230 milligrams. Pasta sauce, 480 milligrams. And then, like the rice pilaf you can, buy in the supermarket with the seasoning, it's 780 milligrams. That's pretty much more than half of what somebody with hypertension should be consuming. Top sources of sodium are breads and rolls, pizza, processed meats, soups, snacks, including crackers, pretzels, chips, cheese, and chicken. And then some surprising sources of sodium include soda. So if you actually look at the back of the can, even a lot of sparkling waters, they do have some sodium content in them. Pasta sauces, bottled salad dressings, like people will think they're healthy because they're eating the salad, but their salad dressing will have more than enough sodium for the day. Ketchup and other condiments, meat dishes such as beef stew, chili, meatloaf, and frozen dinners. Next thing on the list is sugar. So added sugar. It's sweet, but not so sweet for you. Sugar increases risk of cardiovascular disease, also Alzheimer's, dementia, colon cancer, diabetes, hypertension, high cholesterol, obesity, kidney disease, pancreatic cancer, eye damage, muscle damage, nerve damage. So lots of problems with added sugar. The recommended amounts for added sugar is no more than 25 grams for women and 36 grams for men. And this adds up really, really quickly. Like a can of soda, I believe, has more than this amount, the 25 grams. So, cutting out just added, sugary drinks is huge. So almost half of the added sugar in the American diet comes from one source. Like I said, sugary drinks. You may think it's healthy, you're drinking juice, but it's actually not. It's a bunch of added sugar. Other sources include baked goods, candy, cereals, dairy products, desserts. Eat plenty of fruits and vegetables instead of, things with added sugar. Cut back on the amount of sugar you add to food and drinks like coffee and tea. Try to choose foods that are more nutrient dense rather than just empty calories. This also helps you to crave less sugar and less carbohydrates in general. Try to replace sugary drinks with water and, sugar-free options. Read the labels because you will be shocked. This is straight from the American College of Cardiology. So these are some of the types of diets that are recommended by them and what a typical, plate should look like. So you have your fruits, your veggies, your nuts, whole grains, and some sort of, protein, whether it's lean meat, fish, or like tofu if you're vegetarian. The diets that are, known to be heart healthy are the Mediterranean diet, which is it's light on dairy, meat, and sweets, and heavy on fish, olive oil, wine, in moderation, of course. Vegetarian diet, that cuts out all meat. And then the vegan diet goes even further, which does not include any dairy or any animal products. And then there's the DASH diet, which this is, a good diet for people who have high blood pressure. And the main focus is on eating less than 1,500 milligrams a day of sodium, but then also increasing your intake of fresh fruits and vegetables, especially foods that are rich in potassium, like bananas and leafy greens like spinach, kale. This is, kind of another variation of what a healthy plate looks like. And these are kind of the proportions you want to use. So most of your plate should be made up of fresh vegetables, okay, or some sort of cooked vegetable. And potatoes and French fries don't count. Whole grains, healthy protein, and then some fruit. So we've talked enough about diet, but also what's really important for preventing heart disease is exercise. So benefits of exercise include lowering blood pressure. It lowers your bad cholesterol or your LDL, gets your heart pumping, which improves circulation and also opens up blood vessels. Helps shed the extra pounds, which also reduces strain on your heart, also helps with diabetes, helps with hormonal balance, improves your mood and reduces depression, promotes sleep. It keeps your stress levels in check, helps build lean muscle, which burns more calories even when you're not exercising, improves balance and prevents fall in older people, lowers blood sugar, prevents osteoporosis and arthritis, and also helps, with some types of cancers, may delay dementia. And people who exercise regularly are also less likely to, pick up bad habits like smoking, and also tend to choose healthier food options because they don't want to wipe out all of their hard work. How much exercise do you actually need? So ideally, you want to aim for 150 minutes of moderate intensity aerobic exercise or 75 minutes of high intensity exercise per week, plus 2 sessions of strength training. And the importance of strength training, it's coming out more and more, especially in women, really helps with the prevention of osteoporosis, increases lean muscle mass, all of which, are very important as discussed. So moderate intensity exercise, it's basically when you can carry on a conversation, and you're not exerting enough effort. Brisk walking at least 2.5 miles an hour, water aerobics, dancing, gardening, tennis doubles, biking slower than 10 miles an hour. These are all considered moderate intensity. High intensity, you can only say a few words at a time. Hiking uphill or with heavy backpack, running, swimming laps, aerobic dancing, heavy yard work, tennis singles, cycling faster than 10 miles an hour, and jumping rope. Strength training, like I said, very important. What does that include? So lifting weights doesn't need to be heavy. Anything counts. Using resistant bands, you can use body weight and do sit-ups, push-ups, planks, yoga, Pilates. These are core and kettlebell workouts. These are all strength training exercises. And, a lot of times people think that they need to get that 30-minute session in all in a row, but that's not actually true. You can split it up into, 3 10-minute sessions. It's the effect is additive. It doesn't make it better if it's all in one row or not. So really the goal is to just spend less time sitting. Even light intensity activity can offset some of the risks of being sedentary. The goal is really just to get moving, even in between. If you're sitting on the couch, you can get up in between, put an alarm on your phone to remind yourself that every 10 minutes or every, whatever it is, get up and walk, go up the stairs. It doesn't need to be intense. It doesn't need to be you going to the gym or putting in that much effort. Stress management. So prolonged stress can increase hormones and chemicals that promote inflammation throughout the body, can also lead to increased cortisol, which down the line increases sugar. And then also people stress eat or drink in excess because of the stress. So it's really important to figure out what works for you in dealing with your stress levels. Exercise, it's known to bring down stress and help with dealing with anxiety and depression. Take a break, meditate, practice deep breathing, walk away from the problem temporarily, and then obviously you're always encouraged to seek help when needed. Sleep is also very important, and good quality sleep is really important. Try to get 7 to 9 hours. There's no real perfect number, but getting that good quality sleep is significant. A huge issue these days is, our phones. So turn off those devices and enjoy restful sleep. Take home points. So heart disease is the leading cause of death in women in the US. Know your risk factors. Not only do traditional risk factors apply to women, but also ones unique to females. Know what symptom to look out for and act fast. Like I said, there's no silly complaint. I'd rather have patients be safe than sorry. If you're not sure what's going on, go to the ER. Maintain a heart healthy diet, stay active, even if it's just moving, getting up, walking around your house, going up the stairs. Stress management, sleep well. 80% of heart disease and stroke can be prevented through lifestyle change. So this is huge. I mean, it's in our hands, and we need to take charge. I will take questions.
So first question, are honey, maple syrup, or agave any better than
No. So I guess honey and agave syrup are not as processed as sugar, but still it's still added sugar. So no.
that's a
The
weakness of mine.
Yeah. No, I think, it's hard to cut out the added sugar, but I tell my patients that give it like 21 days and just stop putting that extra sugar in your coffee. Just and once you do really eliminate the added sugar, once you start eating a little bit back and adding it back in your diet, you'll feel the difference. You'll,
Yeah.
you'll really feel it.
I love honey, so I do that, but I don't do regular
I
sugar.
think a drizzle of honey is fine. Like one of the good ways of increasing protein is like if you just take plain Greek yogurt and add a drizzle of honey so it doesn't taste terrible and add some blueberries. That's a great snack to have. I think,
Yeah,
but in moderation.
in moderation, yeah.
Yes.
Okay. Do you recommend that all women have an EKG every year?
Yeah, at least once a year. If I do at least every 6 months for my patients.
Okay. If blood pressure is well controlled by medication, is it necessary to control salt intake as much?
Yes, I think it is, because it's not just the blood pressure numbers, but even just that increased sodium and in the setting of having high blood pressure will increase your risk of developing other conditions like stroke, heart failure. So it is important.
Okay.
And even
What?
important for people who don't have hypertension. I
Mhm.
think just the American diet promotes a lot of excess sodium intake, which isn't necessary.
What are recommended tests to get a full picture of your heart health?
So definitely a lipid panel, just a basic lipid panel, hemoglobin A1C or your fasting glucose to know if you have diabetes or not. Um, the other thing is depending on your family history, I also will sometimes, depending on the patient, I will recommend getting a coronary calcium score, which is it's a low dose CAT scan of your heart, and it's used to screen for any plaque formation. Um, there's also other lipid particles that we can test for. So there's something called lipoprotein little a. Lipoprotein little a is basically LDL, but it has another molecule attached to it, and it makes it more atherogenic, meaning that it is able to invade the arteries more so than just your traditional LDL particle. The thing with lipoprotein little a is 90% of the levels are genetically predetermined. But if they are elevated, then what we know is that your risk of developing cardiovascular disease in the future is much higher. So that's like another test, that I do offer for my patients. I wouldn't expect some primary care doctors will do it, but I think if you're really looking to figure out what your specific risk is for cardiovascular disease, it's probably a good idea to see a cardiologist so that, we can have a more thorough conversation and go over your family history and then order tests that, pertain to you. Okay.
So, what are your thoughts on artificial sugars?
So artificial sugar, yeah, yes, it's better than, eating all this added sugar. But I will say that there is some thought that it actually increases your like cravings for carbohydrates and eating more sweet food. So I would say in moderation with that too. I wouldn't go nuts with it.
Let's see if we have any. What do you say about buying food items with added sugar, like honey, that is considered to be sweet already? Um, it's just frustrating.
Yeah, so that's still added sugar. If you look at the on the label, it will say the amount of added sugar total. So even if it's honey or agave syrup like we talked about previously, unfortunately, that all falls into added sugar. Are NSAIDs bad for heart health? Oh, so that's a good question. I had a patient today who actually had this situation. They were taking meloxicam and they had the same question for me. So NSAIDs, they do, obviously we use them a lot for pain. They will increase your risk of cardiovascular events. Now, depending on what your specific medical history is, like if you have just high blood pressure, then sure, take it. But what I tell my patients is try to minimize the dose. So take the minimal dose needed for pain relief and efficacy. Don't overdo it. So that's my take. And obviously, if you already have a diagnosis of heart failure or if you've had a heart attack, I would say really, really try to limit the NSAIDs like once in a blue moon if you're in terrible amounts of pain, but stick to Tylenol.
You say bananas are good for potassium. Are they, but they make my blood sugar go high. Should I still eat them? Is a raw banana better?
So if you have diabetes, then fruits are also something you have to be careful for. So, I think they recommend like 1 to 2 fresh fruits a day. Um, I believe raw banana does have less sugar in them, so if you like them raw, that's probably better. But yeah, with the banana and the high sugar, you just have to be careful, as any diabetic would when counting their carbohydrates.
Is there a target recommended daily calorie count?
There's no one size fits all answer. I think it depends on what your current weight is, what your calorie consumption, like how much expenditure there is rather, and how much activity you're doing. So it all depends. You can actually find these online calculators to calculate exactly how many calories you should be eating.
Can you tell us anything about heart valve disease?
Yeah, sure. So, I mean, it's a huge topic, but there's different types of valvular disease. Some that are, common ones would be like aortic stenosis, which the risk of that increases with age. Also, I touched briefly on like lipoprotein little a, the cholesterol particle, which is like LDL, but worse. That increased levels of that can also increase your risk of aortic stenosis. Um, yeah, something to watch out for. But valvular disease there's a whole spectrum of disease. Like all cardiovascular disease, it increases your risk of heart failure and cardiovascular events. So, you have to get, it's important to see a cardiologist. Depending on the severity of the valvular disease, you probably need monitoring every, 6 months to a year or 2 years. And then also, intervention when needed. It's important to know, like, stay on top of it so that when time for intervention comes, you're ready to go.
Do calcium supplements, vitamins affect your heart health?
The jury's still out on that. There is a different takes on it. I tell my patients, like, hey, if you need, a calcium supplement, just take it. It's honestly, it's a matter of debate. So there's no real answer, I think, but I do tell my patients that they can take it.
What is a heart murmur?
So a heart murmur is actually a sound that comes from the blood moving across the valves of your heart. So it could be a sign of valvular heart disease, but in younger people, it can also be completely benign.
A lot of questions. That's terrific. I don't see any more. I'll give you people another minute. In the meantime, you're welcome to start filling out the survey. Like I said, I'll stay around for an extra 5-10 minutes so you have a chance to complete that. It doesn't look like we're getting anything else in. Thank you very much, Dr. Thanawala. You did a wonderful
Thanks.
job. It was really excellent and made it easy to understand. I know.
Yeah, there's a lot out there. But I think, just being on top of your risk factors is really important, and recognizing them.
You got a lot of thank yous. Thank you. This has been helpful.
You're welcome.
Thank you.
Thank you for tuning in.
And we ended up having 21, which is good as our first lecture for our
Yeah,
topic.
that's great.
So that's good. Yeah.
Okay, well, take
So
care,
again,
everybody.
I'll be staying around. If people would complete the survey, that would be great.
Have a good night.
Have a good night. Thank you so
Take care.
much.
Bye.
Bye-bye.